The majority of the state recommended to bring back those face masks. The CDC says major metro counties like Denver and Boulder now have what's called substantial risk of transmitting COVID-19, and in particular, the Delta variant.
The state health department today reported 896 new COVID cases.
Today, the director of the CDC explained that the Delta variant is not like the others. Research shows it's the only one transmitting coronavirus through vaccinated people.
We have been seeing that if you happen to have one of those breakthrough infections, that you can actually now pass it to somebody else.
Now, 4 hospital systems in the state say they will require all employees to be vaccinated. Banner Health, UC Health, Denver Health, and the VA. Tori Mason live tonight working at the story at Denver Health. And Tori, hospitals clearly sending a message. They're serious about vaccinations to protect the staff and the patients.
Absolutely, Karen, and about 80% of Denver Health employees have been vaccinated, but those who haven't, if they don't get that shot by November, they are subject to termination. Now, those of us who have been fully vaccinated, they're wondering what they need to do to stay safe.
You never know people's status.
Tegan McRoberts got the Johnson & Johnson shot as soon as she was eligible. As cases rise, she contacted CBS 4 with a question many people have.
I haven't heard anything on the news yet about a booster shot for Johnson & Johnson, and that also makes me nervous because I've only have the one shot.
When it comes to a third shot, Denver Health notes the makeup of J&J isn't the same as its counterparts.
The Johnson & Johnson vaccine is a different type of technology than the Pfizer and Moderna, and so boosters really shouldn't be required with the kind of technology.
More than 100,000 Coloradans are behind on their second dose. A single shot will provide some protection, but receiving only one could lead to more harm.
The more it can replicate, the more likely you are to have the emergence of new mutants that might not be as preventable by the vaccine.
Denver has a high vaccination rate, so Dr. Price says she doesn't feel the need to wear a mask. But if it aids public safety, she will again.
Get it as soon as you can. It doesn't matter which one.
And so will Tegan.
If the mandates come back, I'm absolutely going to start.
Doctors say it's important to consider people who are too young to get that shot. If you take a look at the vaccination data right now, people who are in that age group who aren't eligible for vaccines are testing higher, or at a higher frequency than they were before. We're live in Denver. Tori Mason covering Colorado First.